Thank you very much. Good evening, gentlemen of the press. Just a little address after our security meeting this evening, just to also brief us and to say a few things about where we are regarding the COVID-19. So my dear Lagosians, good evening. It's been about 5 days now since the federal government ordered the restriction of movement in Lagos State as part of the measures to help contain the spread of COVID-19 pandemic. It has also been easy, but it is abundantly clear that it certainly has not been easy, but it's been abundantly clear that this is a step in the right direction, as all necessary sacrifice to avoid far more disruptive outcome are being taken. The restrictions have also started paying off. From what we hear from the Nigerian Center for Disease Control, it has afforded them the opportunity to take the advantage of less traffic on the road, to be able to keep up and make appropriate tracing of patients, and they've been able to move around the city a lot more. I would certainly need to thank all of us, all of our citizens that have obeyed the instruction to stay at home. I'm also pleased to announce more good news around the recoveries, which we'll talk later. But at our security meeting today, we're also glad to mention that we do not have any incidents between any of our security operatives and our citizens. They've actually been very cooperative, both the citizens and our security operatives. And like I did mention to them, they need to put a human face to the activity of even this lockdown. And coming out of this meeting, they've also assured me that the security of life and property will continue to be 24/7, round the clock. The security of life and property will continue to remain 24/7, and this is not a time or an opportunity for scrupulous elements in our environment to think that they want to stay under the pretense that there's a lockdown to begin to perpetrate any form of harm or disturbance amongst our citizens. They have assured me that at day, at night, they will continue to make the environment safe and secure for our citizens. And we also mentioned that we want to advise a lot of our companies that are under the exemption rule that if they can walk around having staff buses for their staff so that they can move more en bloc as against needing to clear every of their individual workers, that it will be a lot more easier if some of these companies have buses that can convey their workers from one point to another point. And so it's important to mention that we've had about 24 discharged patients. In fact, it's 25 now, because just this afternoon, and I'm sure some of you have heard that we also discharged another patient at the mainland hospital in Yaba today. But just as we've seen patients being discharged, unfortunately, we've also seen new cases being discovered in the metropolis. As at yesterday, 11 new patients were diagnosed, which has bring the total number to about 109. And unfortunately, too, we've also recorded one death in Lagos. The Permanent Secretary Health can answer further questions, but the brief I got was that even this patient died before even his test result came out, meaning he had a lot of underlying other ailments around kidneys and a lot of other issues which were not identified before then. And so I think we need to give credit on behalf of Lagosians to thank all our medical personnel, our emergency personnel, and all our ad hoc staff, our volunteers. And I want to imagine that when the story of this brave fight against COVID-19 is told, there's no doubt that their sacrifice and service and heroism will feature prominently. As a government, we shall continue to work with the federal authorities, represented by the Presidential Task Force on COVID-19, the Federal Ministry of Health, the NCDC, and other international partners like the World Health Organization, UNICEF, who all of them have remained partners in this journey with us. Dear Lagosians, you will also recall that when we began this battle, I promised that the vulnerable and indigent segment amongst our society will not be abandoned or left behind. It was in that same vein that I approved the welfare program, which was meant to touch the first set of 200,000 households under our welfare food stimulus package. I must assure you that we have since returned to the drawing board for us to look at what has gone wrong, what we need to improve in that whole exercise. But however, I think I want to seize this opportunity to further announce additional ameliorating measures to complement our welfare food stimulus package. So the Lagos State government will, for the duration of this lockdown, at the first instance, throughout the month of April, we will take full responsibility for the medical bills of all patients who fall under the following category, and they present themselves at all our secondary health facilities, meaning our 27 general hospitals and the maternal and child health facilities that we have around the states. Emergencies, casualties, cases, including registration, laboratory tests, surgeries, will be treated free of charge. Maternity cases, all pregnant women that have to do delivery in this month of April, either cesarean or normal delivery, will also be attended to free of charge. All accommodation, what do we call it? All admission within this period too will also be covered and will be treated free of charge in the month of April at the first instance. What this means at this time is patients that have the above listed conditions will need to access the hospital will be treated free. I'm aware that this will also further burden the already burdened medical personnel that we have. But they've assured me, and that's why I'm excited, they've assured me that they will rise up to this challenge and they will be able to spread themselves and be able to offer this service to our citizens and our vulnerable at this very crucial time. Let me again seize this opportunity to remind you that while the road ahead remains long and uncertain, I must, however, tell you that the bulk of the battle is fought and won in our mind. We must condition our mind and reinforce our psyche to take on that of a winning approach. By this, I mean that we must begin to picture life after this pandemic and how we need to return to normalcy. We must continue to reassure ourselves that we are not weaker as a unit, but much stronger, and our confidence lies in the fact that working together, we have and will always emerge victorious as a people. Being a Lagosian has always been about demonstrating the spirit of resilience and optimism that is cited and is evinced around the world. I have no doubt, but by the grace of God and with all the full support of every Lagosian, we shall also surmount this. Let me also take this opportunity to remind our citizens that the security operatives will not entertain any breakdown of law and order. We are at a time in which we all need to be our brother's keeper, and ensure that we'll continue to live and obey all the laws that we have around us. And to say that every law-abiding citizen needs to also be encouraged, and I want to salute all of you. I want to implore you to continue to obey all the directives that has been issued by health experts. Let us continue to practice social distancing. Let us continue to shun large gathering. Let us cover our mouths when we're coughing or sneezing. And let us self-isolate and contact a doctor if you feel unwell. And to those who insist on flaunting our directives and guidelines, we seek to take undue advantage of other fellow Lagosians at this time, and all those who aim to undermine the efforts of the various health authorities responsible for keeping us safe. Let this strong warning go out, that the strong arm of the law will catch up with them sooner than later, and they will be brought to the full justice swiftly and comprehensively. I certainly cannot continue to thank enough all our health officials, all our first responders, all our volunteers who have continued to support us and who have continued to ensure that we all work collaboratively. And I want to assure you that this, like I keep saying, will blow over very soon, and we'll all have a normal life sooner than we'll expect. I want to thank you very much, and I just want to open it up to a few questions and clarification before we call it a day. Thank you very much.
Good evening, Mr. Governor. Good evening, Mr. Governor. My name is Emmanuel Odemi. I represent Classic FM 97.3. I represent Classic FM 97.3. It beats 99.9 FM, Nigeria FM 102.7, and Lagos Talks 91.3. Sir, it appears that the lockdown, generally, there's a misconception about it. Speaking to people in the members of the public, in some quarters, it is assumed that once it is evening, that the lockdown is over. And even during the mornings and the afternoons, there are people who apparently directly decide on their own to flout the directives of the state government. It goes further that in the evening, if you look at major bus stops, some of these yellow buses do operate, and they commute people, starting from Iyanoworo, after the Third Mainland Bridge, to all the other major bus stops. So I want to know what the state government intends to do about this problem. Thank you, sir.
So that's why we have all the security operatives behind me. We have reviewed the situation. We are aware of the concerns you've just raised. It's true that we've seen a lot of people trying to flout the rules, especially when it gets to 7, 8 o'clock. Today, I think we've arrested almost 400 vehicles, all yellow buses, that the Commissioner of Police reported to us, and they've also been further given the directive that the lockdown is 24/7. It's not that you are meant to restrict at any point of the day. It's 24/7, and people need to obey the rules. People need to comply fully. We've discussed it extensively this evening, and they are going back to ensure that nobody is left, nobody is spared. If they need to continue to arrest your buses, they will do. Over 400 or so have been arrested from what we're told, and they will continue to do that. But that's why we need to continue to encourage our people to stay away until when all of this is over.
My name is Ohi Odiai. I work with Arise News. We're going to the second week of the lockdown from tomorrow. The numbers are rising. Do we expect an extension of the lockdown? Do we expect an extension of the lockdown, the total lockdown in Lagos? Number two, even as we deal with the coronavirus, Many are saying they are also dealing with what they call the hunger virus. Yet, you've got palliative measures in place. But from reports we've seen, and thank God you've also upped the game as regards that, from reports I will be saying, it's not getting down to the vulnerable ones. What are you doing to ensure that this is achieved more as we go into the second week of the lockdown? And finally, maybe one of the security men will answer this. In dealing with people who flout these rules, can we be a bit more humane? Because we're already dealing with the fear of the coronavirus. They are home, they are unable to eke out a living. Can we be more humane in dealing with these people? Thank you.
Thank you very much. I think the first question was around, are we going to extend the lockdown? So it was a federal government directive, and I'm sure both at the federal and with ourselves, we're reviewing what we're doing. This is just day 5. So in the first 14 days, there's still about 8-9 days more to go. So I'm sure it's something that all of us, including our federal authorities, will be reviewing. So the lockdown was not a directive only of the governor. It was a national decision, and it has a national backing. So if there's a need to extend at that time, I can assure you we'll make the call. Regarding the palliatives, it's rather unfortunate, but like I did mention when we started it, that if I get a 90%, I will consider it as a pass mark. There's certainly no way, given the population that we have, that you'll be able to go around everybody. So the challenge that we have is that our people are not just patients. You know, and we knew that one of the ways we could do this thing is to do it in different phases, right? So it's the phase 1 that we've done, and like I said, we're reviewing. In fact, we've started reviewing the operations to get a better model in which we'll go out from next week with a phase 2 that we imagine that will be a lot more impactful, and we'll be able to also directly target the people. You know, we're dealing with an environment where data is also not very available. Right? And because we have, population that is mixed, that is crossed, right, it becomes a bit difficult. It's not something that we had planned, a year or 2 years before now, right? Part of the things that we have is only the, what we call the so-called, the household survey, and so people have said to us that when you get to somebody's street, you should just knock on the person's door. They've forgotten that when you come with a big truck, everybody on the street can see what the truck looks like. And so it's not been identified as number 7 and number 8. Everybody wants to have a bit of it. So that's where we have the challenge. And that's why we keep explaining to people that they need to be patient with us, right? And people also need to be sincere. If you don't need to have it, you don't need to come and rush. It's the vulnerable, it's people that will continue. Hello? Okay, sorry, thank you. So that's why we needed to also think through another stimulus. That's why we're going health. We realize that people, even at this time, right, that are vulnerable and, they've gotten pregnant or they've fallen ill during this period, and they do also have access to daily finances, we also can help out. So you can see that this is another level of intervention that will touch and will go down to the vulnerable people that we're talking about. So if you are not pregnant, you cannot create pregnancy overnight, right? If you're not sick, you cannot create that overnight. And so this will speak to the people that we wanted to speak to. This is another strategy of ensuring that we reach our vulnerable and that mark of our population, and government will comment and continue to be there for them. The third component of your question is the security operatives. Is one of my comments I said, I think we need to commend them. I mean, in Lagos, like I did mention, we've not. Okay, so the last part of the question is regarding the security operatives. Like I mentioned, I think we need to commend them. There's not been an incident of any backlash on their management of our citizens thus far. And when we're in a meeting, I said to them again that we need to do this with a human face, right? We've seen a few reports, but not in Lagos. But we needed to encourage them and enforce again that they tell their men that they need to do this. You know, the atmosphere is charging off. You know, people are under a lot of pressure, right? Even if people run foul of it, there's all the other ways in which you can correct them. So that I've also, you know, it's only if it now becomes a security issue that they know what to do. Thank you.
Thank you. Is that working? Good evening, Your Excellency, everyone. My name is Christy. I work with CNBC Africa. My question is on the back of the palliatives that the state will provide for the vulnerable within the health sector. Now, we all know that a significant number of the vulnerables in Lagos who are in dire need of critical health care stay home and patronize traditional medicine generally, even before the COVID-19 season that we're in now, because they cannot afford it. Now that the state, as part of its palliative measures, is throwing open the doors of the health sector, so to speak, the general hospitals, are you confident that the state has the capacity to take on more cases beyond COVID-19 this season? Or should we anticipate some makeshift health sector provisions or expansions in the near term? Thank you very much.
Well, thank you very much. So if you look at the numbers, and I've gotten assurances from my health practitioners, we actually can handle them. So the people that you said patronize the traditional health, it could be financial, right? And that's one of the things we're taking away. Is that one of the burdens that we're taking away now, right? So we're very direct with what we're asking. We know what our numbers month on month is on for deliveries for pregnant women, right? We know what and so we've also done an exponential growth of that percentage. And we've checked in our system, and we said we can still cope with those numbers, right? Emergencies are things that nobody can, you don't know when it's going to happen. And when you have surgical or any form of emergency, right, resource might be in short supply at that time. And we said that for emergencies that are coming into our emergency ward, they will also need to take them on, right? For regular day-to-day malaria and headache, beyond, you know, we treating you and running your tests, you certainly will be discharged. So there's really no additional stress than that. But it's really more of a financial palliative that when people fall sick and they are probably low on cash and they are not encouraged to want to come forward, we have put up this to say to them that you actually can come forward and you can get treated, especially for even our pregnant women and mothers that are, I mean, we're expecting that they're probably going to deliver anytime within the month. So that really is what we want to rest assured that even whilst COVID-19 is saving life, we don't want to be losing life of people not wanting to come forward and deliver at the right time where they are meant to have their deliveries.
Good evening. I am Mary Alale Yusuf from Channels Television. Your Excellency, there have been reports about the person who traveled in from Holland, that he went to several health centers before the government got a hold of him, and that he was cagey with information about his illness. So he has probably come in contact with a lot of people. Should we be concerned about contact tracing this case? Because do you know everywhere he's gone to and everyone he's associated with, you know, in the time that he came? That's one. Number two, we are aware that we have a lot of open markets now, but the whole of Lagos isn't yet covered. Are you planning to do more, set up more of those open markets in other areas of Lagos? The third one, the emergencies that you're going to be attending to, this palliative measure that you are embarking on now. If someone gets sick, does the person come to the hospital or does the person call in view of the lockdown that we have now so that they go get the person? How is it going to be done? And lastly, do we have any more recovered patients? Some good news.
Yes, last one. Yes, we got one today. If that is enough good news, we discharged a patient today, just this afternoon, and we're still believing and hoping that tomorrow or next tomorrow we'll have a lot more. I'm not a doctor, but we're being very hopeful. Regarding your first question, the Permanent Secretary, Ministry of Health, will answer the question directly, but it's rather unfortunate. You know, we're dealing with a dead patient right now, so I really cannot begin to talk down on the dead. You know, it's not fair, right? But it's rather very unfortunate, and like you said, that this particular patient refused or was in denial or did not fully disclose previous ailment that could have led to an early detection and treatment early. I think it's just a lesson that we need to communicate to our citizens right out there, that in the event that you contact a medical doctor or you're in front of, please let's give them full disclosure about what has transpired, what is our medical history, where we've been to. That is the only way where they can help you before it gets to, you know, a very critical and an unfortunate incident like this. You know, but I'm sure with the health practitioners, maybe they haven't done a bit of a clocking before it happens. Maybe they will be able to go back and see, you know, with the families that he has left behind or some, and try and backtrack and see if there are some other, you know, tracking or tracing that they can do. So Dr. Boye will speak to that. But let me just take the other question, which is, are we going to increase the community markets that we have? Well, thank you. It goes to show that it's working. It goes to show that people are excited with the fact that we have them. That's why they'll be asking for more. So we will sit back and we'll tell the small committee that is working on it and see how we can open it up and get a lot more corner markets, you know, in the coming days. You know, maybe sometime next week we'll be able to announce maybe additional 10 or 20 based on the studies that they're doing. Dr. Boye.
Hello. Okay. As Mr. Governor has said, from the clerking that they did in the hospital, we're going to then work with the family that he was staying with, and we're going to start listing all his contacts, and we will follow up on all those contacts as we do with all our suspects. So we will follow up on every contact that we see, that we line list from the history that we get from the family that he was staying with, and we will track all of them and follow their contacts as well. Okay.
Okay, yeah, I think the last question is people that are going to the hospitals. Well, an emergency is an emergency. You will know it's an emergency. So we will take, no, you don't need to call. You just drive to your secondary health facility, your regular general hospitals, which, I mean, there's several of them, 27 of them around the state. You drive in there and they will be able to take you, on. And what considered an emergency is really a doctor that can answer that, but you will know it's an emergency. And once it's an emergency, they will take you on. If it's an accident emergency, which is usually the A&E, you will know it's an accident, and they will be able to treat you in. And if it's even a surgical emergency, for as long as it is identified as an emergency, the medical practitioners, they know, they will take it on and they will treat accordingly. Gentlemen of the press, thank you very much. Thank you very much for listening, and have a good evening. Thank you.